The annual East African Healthcare Federation Summit started off with health practitioners calling for universal health coverage for all member states to reduce on the financial burden on healthcare services. The Permanent Secretary, Minister of Health, Dr. Diana Atwine, noted that there is no competition in provision of service delivery for healthcare, but focus more on essential investments to transition Africa Pharma from imports to self-sustainability.
Health sector is not a monopoly of anyone. We cannot say public sector will be able to do this or private sector will do it. It's not a monopoly. It's everyone's responsibility. If we are called upon to provide the service, regardless of where you are, it is our responsibility, and it is our noble responsibility to provide that service.
How can we do equipment placement contracts? How can we do management contracts so that we allow the quality and standards in the private sector to be met in the government facilities? Professor Kamarogo said that the minute government facilities meet and compete with private facilities, you'll see the cost of care going down. And that is where, as the Federation, we're driving. How can we enable local capacity to meet the local demand for inputs so that the output cost actually goes down?
The East African Healthcare Federation convenes 7 East African countries that leverage technology in health, digital health innovations, and preparedness for global emergencies.
To pool funds for healthcare and other social protection needs, because that is one way of protecting the poor from poverty through catastrophic spending. And for healthcare, it is one way to keep people from dying, because many serious conditions like cancer or kidney failure kill not because the natural outcome is death, but because those who have those conditions cannot afford care.
But if we, as the public and the private sector, ensure that we get the best training, we get the best medicines, that we are fulfilling what we need to do, whether public or private, working together to meet the needs of the health sector. That's how we're best served in Uganda.
Over 200 health experts from private sector across the region participated in the 3-day workshop to forge a way on how best the public-private partnership can strengthen access to quality and equitable private health care service. Zahara Abigaba, UBC News.